Why do I have difficulty breathing when lying down? Many things can cause difficulty breathing when lying down, including diseases, anxiety disorders, and lifestyle factors. It isn't always a medical emergency, but it's important to make an appointment with a doctor. Becoming short of breath after physical activities or during moments of extreme stress isn't uncommon. However, difficulty breathing when you are lying down, called orthopnea, may be a symptom of a serious medical condition. What causes difficulty breathing when lying down? Common causes of difficulty breathing when lying down are congestive heart failure. In some cases, breathing difficulty can be a medical emergency. Heart failure can be a severe cause of difficulty breathing when lying down. It occurs over time and results when the heart can no longer pump blood efficiently. All types of heart failure can cause shortness of breath. It is usually pulmonary edema, or fluid retention in the lungs, that causes shortness of breath when lying down. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, COPD, refers to a group of diseases that cause breathing problems. It includes chronic bronchitis and emphysema. The symptoms of COPD include chronic coughing, difficulty breathing with activity, wheezing, frequent chest infections, such as bronchitis. No cure for COPD is available yet, but you can relieve breathing difficulties with fast-acting inhalers or other medications people use to clear lung infections. Obstructive sleep apnea. Sleep apnea causes shallow or brief pauses in breathing while sleeping. The two types of sleep apnea are obstructive sleep apnea and central sleep apnea. Central sleep apnea results from your brain not sending the proper signals needed to breathe. The most common sleep apnea occurs due to obstruction of the airways. The symptoms of sleep apnea may include difficulty sleeping, daytime fatigue, snoring, headaches. Snoring can be a cause of your difficulty breathing when lying down flat. According to the American Academy of Otolaryngology, more than 25% of the population snores regularly. Snoring occurs when your tongue, throat, and the roof of your mouth, soft palate, relax during sleep, obstructing your airway. This can happen because of your anatomy, alcohol consumption, obesity, or a cold or allergies. Complications of snoring may include daytime sleepiness and difficulty concentrating. Obesity. If you have obesity or overweight, you may experience difficulty breathing when lying down. This is because having more weight may put pressure on the lungs and diaphragm. You may experience difficulty breathing with obesity because of a hypoventilation syndrome called Pickwickian syndrome. You can temporarily relieve difficulty breathing due to obesity by sleeping on your side instead of your back. Lying on your side can decrease the pressure on your lungs. Gastroesophageal reflux disease. Lying down too soon after eating may also cause difficulty breathing. This may be due to regurgitating food up your esophagus and is a condition known as gastroesophageal reflux disease or GERD. It may also be the pressure of the food in your stomach pressing down on your diaphragm. Your diaphragm separates your stomach from your lungs. Anxiety. It is a typical part of life to have occasional stress. Things such as difficulties with money, health, or family can cause stress. However, if your chronic stress interferes with daily activities, it may be anxiety. Symptoms of anxiety or panic disorder may include chest pain, palpitations, shortness of breath, rapid breathing, a choking sensation. What symptoms should I look out for? Initial symptoms may include feeling breathless upon lying flat on your back. You may feel like you have difficulty taking deep breaths or breathing out. Other symptoms may be present if this symptom occurs due to a medical condition, such as heart failure, sleep apnea, or COPD. Other important symptoms. If you experience any of the following symptoms along with difficulty breathing, get medical attention immediately: chest pain, fever, rapid breathing, rapid heart rate, weak pulse, dizziness upon standing. When should I get help for breathing issues? Breathing difficulty isn't always due to a serious medical condition, but it's important to talk with your doctor about any breathing issues. Your doctor will perform a physical exam to help them diagnose the underlying cause of your breathing difficulties. They'll ask you about your symptoms and medical history. Tell your doctor about every over-the-counter or prescription medication you take. Certain drugs people take for treating pain, muscle stiffness, or anxiety can cause breathing issues. Your doctor will pay close attention to your heart and lungs during the physical exam. Additional tests may be necessary, such as a chest X-ray to view the heart and lungs, an echocardiogram to view and diagnose potential problems with heart function, and electrocardiogram to test the electrical activity of the heart.